I'm Dr. Garry Gordon. This is your introduction to the module for the Institute for Integrative Medicine on detoxification and inflammation. I am the co-founder of ACAM, the American College for Advancement in Medicine, because my life was changed through one method of detoxification called chelation. I happen to have had serious heart disease by age 29, and I have multiple genetic issues. So at age 76, for me to feel as good as I do today, I believe is proof that you can help every patient better than any medical center if you will learn the principles of detoxification and inflammation that we will cover in this module. I have had the privilege of attending hundreds of conferences around the world, and I have thousands of hours of postgraduate training, and I'm standing in my library where I'm going to give you a brief overview that there's a few books on every subject in this library, which I collect when I attend these lectures. I often buy the reference work of the speaker. And so if we're going to have you be able to help every patient better than any other medical center around, it's because there's a multifactorial nature to the health problems we encounter today. And if we look at the problem then, detoxification and inflammation, and how do they interrelate? Everyone knows that inflammation ties to all the degenerative diseases. I have to teach you how, by getting the toxins out, you will be helping with the inflammation. But everything that I teach is multifactorial. A simple acronym is FIGHT for your health. Food, infections, genetics, heavy metals, hormones, toxins. That acronym will help you understand that your patients that can present with anything from autoimmune disease to cancer, to Alzheimer's, to disabling diabetes, weight problems, premature aging, you have to be knowledgeable enough to let them know that you're going to help them learn how to thrive in a toxic world. And we have many, many books that teach you how our food is making us sick and what we can do about it, which might cover, for example, issues about genetically modified food. But when you get into what's toxic and what's not, people are aware today that bisphenol A is a problem, but they don't fully understand that it changes a gene in an epigenetic fashion so that they don't methylate well, and you'll have to give them methylation support. My good friend Doris Rapp has written many, many books. One of them is Our Toxic World. That's one of many that sit on the shelves in my library. And if we move from the general topic of toxicity into specificities like toxic metals, which are a part of the game, because you also have to deal with polybrominated diphenyl ethers and dioxin, DDT, PCBs, etc. But toxic metal syndrome, how metals are affecting your brain, will give you another overview, and specifically just one book, Diagnosis Mercury, Money, Politics, and Poison by Jane Hightower, an internist at the University of California in San Francisco. That book will wake you up to why the practice that I will have you do will largely be self-funded by patients, because government doesn't want to hear that we have polluted our earth. And on my website, gordonresearch.com, you can watch the CNN special called Toxic America. So there'll be no question that everyone you see doesn't need to spend $4,900 to send their blood to Mount Sinai School of Medicine, which is what we've done with the Environmental Working Group, EWG.org, where we proved that every baby that's born is loaded with at least 50, 60, 70, 80 neurotoxins and 50 to 80 of the what we call endocrine disruptors and the carcinogens. And now we've proven that the pregnant mothers carry this same burden, and it's obviously being bioaccumulated in the child. So my course has to teach you how to motivate your patients to spend their time and money to lower the level of toxins. Now, whoever you see as a patient, no one could ever have spent as much money as David Duncan. He did $500,000 worth of studies on his body to prove that there's a lot more that can be done with today's medicine because knowledge is doubling every 2 years. So do you want to make every patient do $500,000 worth of tests to wake up to the potential of how many things we could do to help them? Or do you want to have a good program where you're knowledgeable enough to know what to do about food? Because that's not a simple thing. Food ties into learning that food allergies can make us fat. Or to the big problem of killer foods. When scientists manipulate genes, what is the genetically modified foods doing? We now find a pathogen has been introduced into the environment by apparently Monsanto that is now actually causing major problems of infertility in animals and may be contributing to the infertility in humans. But as we look at simple answers, everybody now knows get off the gluten, book after book. Everyone's looking, maybe I can get well and just alkalinize. It's not that simple. It's an interesting piece of a puzzle. But if people don't have the money to be able to spend $1,000 to measure which foods we're sensitive to, we might wind up having them just get a book on Amazon, a used book, $3-4. Jeff Bland, 20-Day Rejuvenation. It tells people foods that they can buy and stop eating everything they now eat. That's a quick way of finding how much of a contribution foods you're sensitive to are making to your poor health. I want to empower you to be able to help every patient that comes in your office better than anyone else, and I want to do it through helping focus your understanding. But this is a great book, Memoirs of a Most Unusual Doctor. This is called A Medical Detective. This book tells you every one of them is a success story in which when you found the food the patient needed to stop, miraculously improving their health. So look at it that no one can know everything, and as long as you stick to the idea that you do something in all these categories, you'll be detoxing people and lowering inflammation. I have friends like Dr. Simon Yu that are expert at the EAV testing, that's the electroacudiagnosis by Vol, and they're able to find the parasites and other things that many of the doctors don't get. But we all need to be aware that homeopathy is still the most cost-effective step we can do in detoxification and helping people overcome health challenges. But I want you to be able to help every category of patient, whether it's somebody who just wants to slow their aging process or is really worried about cancer, because I can assure you, we have knowledge today, 10,000 patients, 10 years, no one died of cancer in the 10 years by simply doing cancer marker tests and teaching people what to do with detoxification and inflammation, so cancer markers that were just before the lump or bump always got better. But my good friend Dr. Sinatra and Dr. Roberts have written a book about reversing heart disease. So I want you to know that I haven't had a patient die of a heart attack in some 20 years, and I cancel bypass on everybody, and I don't do stenting on everybody. And so as a former radiologist, I have the knowledge to know that a blockage in an artery doesn't prove anything. Takes a PET scan, and people don't need the surgery that's being done. You can reverse disease. But so we need to have you knowledgeable enough to know that you can talk about anti-cancer, a new way of life, an excellent book by David Servain Schreiber, where he's 13 years survival of a brain tumor now because he learned the lifestyle, the diet, and the lowering of stress, and the improving of sleep, and all the things we have to do. So as we think about it, some patients are going to come to you mainly because they're losing memory. Now, if you believe Alzheimer's is a disease, this expert, former director at NIH, world-class researcher on Alzheimer's, says it isn't a disease. Why do I make such a big point out of that? Well, I've treated a few thousand children with autism and ADHD and depression and obsessive compulsive, so I find that no matter what the diagnosis is, the correct treatment always is FIGHT. So if I take you through that process, some people will be willing to stay on a better diet when you want to lower their CRP and deal with the direct measurements of inflammation. But that's only one test. There are many other markers of inflammation, so you don't want to get buried in just monitoring one test. But stopping inflammation is what we do when we do the whole lifestyle program and get the toxins out. Now, as we start to get into this big problem, what are we going to do about the vaccinations? Because that's still being done daily, and that has some adverse health effects, which we will cover at another time in another place. But I want to get back to the idea. I see doctors who are taking this module as being able to offer a second opinion. And Dr. Groupman, who's been one of the top doctors at Harvard, wrote an excellent book on this whole issue of the need for second opinions. Because a second and a third opinion will never agree. And so the patient has the right now to take the least toxic of the choices. And as Dr. Groupman points out in his book, it's frightening that the mainstream doctors today, within 1 minute, have stopped listening to what the patient says, and they've already made their mind up how they're going to get that patient through the system and out the door and get reimbursed by a third party. So we have to change the healing system. There's a crisis in healing. So A Return to Healing by Len Zaputo is an excellent book. And another book by Larry Malerba. He has really done a great job challenging the assumptions of conventional healthcare. Green medicine. I have to make you comfortable to know that we believe that the AMA published the article that drugs are the fourth leading cause of death. Well, if you read it carefully, you'll agree with me. Drugs are the leading cause of death in America, ahead of heart disease and cancer. But you have to be confident in your knowledge when you offer the alternatives to patients within the concept of detoxification and inflammation. You are dealing with causes, not suppressing symptoms. So we have symptoms today, epidemic. We have babies being born with GERD and everybody living on Nexium. And yet if you read about the danger of these antacids and proton pump inhibitors, you're going to have much more fractures and more bone damage because you can't fiddle with the system, taking away what we need. And the facts are, as you will read in a book, most of us actually need more acid. We don't need antacids, but the symptoms are the same, and unless you do the Heidelberg capsule test, like Dr. Jonathan Wright and I do, you don't know what the patient needed. Now, it's interesting that Andrew Weil has really been teaching integrative medicine at the University of Arizona, and it's part of what's sweeping the country with the great work being done with Mark Hyman and the Institute for Functional Medicine. The new medicine is going to come in. But this book, You Can't Afford to Get Sick, has some very powerful messages that you want to be aware of so that you're comfortable telling patients that you offer not just an alternative, you offer better, more advanced medicine. Now, today, you're going to see over 100 diseases are now thought to be autoimmune, and that even includes autism. And when we talk autoimmune, this book, written by Donna Jackson Nakazawa, is endorsed by Senator John Kerry, by Frederick Miller, the chief of environmental autoimmunity at NIH, and by Mark Hyman, author of the New York best-selling Times Ultrametabolism. He's the head now of the Institute for Functional Medicine. And Dr. Neil Rose, MD, PhD, director of Johns Hopkins Center for Autoimmune. The book is endorsed. Why? Because this book, when I read it, caused me to put together the acronym FIGHT. Everything is multifactorial today, and as long as you do a little something to each of the categories, you're going to help the patient. But you could be the world's expert, for example, on getting out dioxins and PCBs and how important it is to use a Hubbard tank and do sweating and the right kind of fiber and use what I call my power drink, which has got in it fiber and greens, and I put in it a very advanced form of vitamin C that's well absorbed, and I do methylation support in this formula, and across the board I use things that are glucosinolates like you would get out of your cabbage and broccoli and diindolmethane, and so in here I use maca. Anyhow, what is interesting is that my power drink is my answer to approaching this entire issue of the epidemic of ill health that we see in our country today. If you just listen to Doctor Radio, which is a 24-hour program on every day of the week from NYU Medical Center, you'll hear how impossible it is for doctors who are merely using drugs to suppress symptoms to really do good for their patient. So one of our really nice doctors in Arizona, where we have a special board for doctors that wish to practice homeopathic and innovative medicine, we call it integrative. In this state, Martha Grout has written a book with the assistance of Mary Buttinger and Alphabet of Good Health in a Sick World. It's current and it's up to date, and its references will save you a lot of time. But we also have one of my many mentors, Dr. Abraham Hoffer, MD, PhD, one of the first ones to treat schizophrenia with nutrition, and a Canadian physician, recently passed away at about 93 years of age. His assistant wrote the book, Nutrition and Your Child's Soul. Easy to follow approach keeps healthy children healthy and helps unhealthy children recover. Tremendous amount of knowledge. No one had more ability to study the power of improved nutrition to deal with toxic conditions. But you might wind up seeing patients that are really interested in longevity and stopping the aging process. So the new term singularity, and Ray Kurzweil, who works with my good friend Terry Grossman in Colorado, has written a great book about radical life extension. We are living in exciting times. And Dr. Lipman wrote a book, Staying 40 Forever, without even doing diet or exercise, by knowing enough. But you can never know enough, because as Dawson Church, PhD, says, epigenetic medicine and the new biology of intention. This is like my friend Dr. Bruce Lipton, biology of belief. These people have seen that what we think can materially change the problems that we're seeing, because these toxins have caused epigenetic changes. The bisphenol A, the hardener in all the plastic bottles, is in every human today. Phthalates are in 10,000 times the safe levels in everyone tested today. So what are we going to do? We're going to have just one nutrient that handles it all? If you had only one, and that's all you could take, I'd be looking at vitamin C. The Remarkable Controversial Story of Vitamin C by Steve Hickey. This book will open your eyes to how little you really have been taught. And when you see the 1,200 references put in this great book, Curing the Incurable by Tom Levy, or then another book with 700 references by Professor Bush, founder of cardioretinopathy, talking about how vitamin C alone can stop all the epidemic of people going blind, you would find in our course that, for a simple example, Harvard has the ability to tell you how much lead is in your bone. And that, non-invasively, using about a $500,000 machine, so we don't have a lot of these, but it's an X-ray fluorescence detector, so instead of just telling you how much calcium is there, they tell you how much lead. They publish in the Journal of the AMA, right out of Harvard, that the level of lead in that bone determines how soon you go blind with your cataracts, and if it's affecting your vision, it's affecting your brain. So you will understand that every health condition, if you're going to optimize health, we're going to all have to detox. So I can't do it all with just vitamin C. I need the vitamin D. And I can't do it all without that, because I wrote the book, The Omega-3 Miracle. And we put these things together. Nothing works without a good night's sleep. And now we have natural products that are really restoring sleep for people without having to use drugs. But as we get deeper into the whole story, we're going to realize that FIGHT, the second H, is hormones. how many people you're seeing really would only get optimal health if you added thyroid. The book Hypothyroidism Type 2 will explain that. And another book, Fundamentals of Naturopathic Endocrinology, will give you alternative ways to support our glands, because if you learn that the pituitary concentrates mercury and that we all have mercury, because when we burn coal as far away as China to make electric power, we get that mercury, not just in the oceans to pollute all the fish that we eat. It's coming in the actual air that we breathe with particulates. So as the person that brought chelation to the world, because it changed my life, because on the 8th treatment for the first time in my life, I'd always been a cardiac cripple. I could never participate in sports. On the 8th treatment, I could run up the mountain. So the book Chelation of Heavy Metals, with 800 references, starts to bring you into the complexity of learning how to make you and your patients healthier. But as we start to look at food, infections, who knows what infection is in your patient? There's an epidemic now, people thinking that maybe they have Lyme. And I've given up on wasting money measuring and looking for one of the organisms called Lyme. I just called it lowered immune metabolic encephalopathy syndrome. I call it Lyme's. So I don't waste money on that, because stealth germs are in your body. We have all of these books today teaching us the coming plague. We have many, many books telling us that we all have infections. We not have just the Candida. We have cytomegalic virus, according to Harvard University, in approximately 100% of all people, and it's growing in the plaque on your arteries. So what are you going to do about infection? Got a magic cure? Well, yes, there's oxidative medicine. Oxidative medicine with ultraviolet blood irradiation and ozone. I can lower the titer in HIV 99% with about 5 treatments, and I can do the same with hepatitis C or many of these other infections. But I'm using lots of silver, but there's people that need to have other choices. Some people are doing great things with artemisinin, and there are many herbs that are helping. As we start to look at the Healing Lyme book by Dr. Stephan Boner, there are great references. But to understand, where did we get all these infections? A brilliant book by Michael Schmidt just says, let's move beyond antibiotics. Let's stop throwing hand grenades at all these bad guys, because we all have infections at all times. That's part of where inflammation is coming from. But if I get your lead down to the lowest possible level, according to archives of internal medicine, it is proven that all causes of morbidity and mortality are tied to how low I kept your lead. And it would be the same if you studied mercury. So across the board, Beyond Antibiotics is simply trying to teach you the strategies for living in a world of emerging infections and antibiotic-resistant bacteria. Yes, I like the advanced silver products. Yes, I need to know how to use high-dose C. What is a really high dose? Well, that's why we found some forms are better absorbed than others, and you can have certain forms that people can take 30 or 40 grams a day without living in the bathroom. But as we move beyond all of what we now know, we have to then add not just intention, but an understanding of the physics of the world we live in. So it would be useful to understand a little bit about quantum mechanics or quantum physics. And as you get into that, it's pretty exciting to put in a good book on energy medicine by Keith Scott Mumby, MD, PhD, a good friend of mine, who has learned a lot about these things. Or just to learn, for example, that Lynn McTaggart wrote the book The Field. As we begin to understand that there is knowledge that allows your dog to know that you're coming home without you having to call on the phone, the dog starts barking as you start to get near the house, because The Field by Lynn McTaggart opens your understanding of magnetic therapy. And magnetic therapy in Eastern Europe, a review of 30 years of research, becomes very powerful today when NASA tells us that the Earth's electromagnetic field is collapsing and we're down to 0.3 Gauss from what we had at the time of dinosaurs, which was 30 Gauss. When the Gauss gets down to 0, metabolism stops and you won't move. So we are learning how to add physics to the application of our entire approach to improving health. So since I've attended thousands of lectures around the world, it is my pleasure to put together the 10-hour course and to work with you, and I look forward to meeting all of you one-on-one as you take the module on detoxification and inflammation, and I'm Dr. Garry Gordon. Thank you for your interest.